trying to get pregnant and it's just not happening? Here's something many people don't know. 3 out of 10 women have a small problem in their body that quietly gets in the way, and most of them have no idea it's happening. I'm talking about small vaginal infections like yeast and BV. They feel mild, almost nothing, maybe a tiny itch, a little smell, or sometimes no sign at all. But these small infections can make sperm die faster, weaken your egg, and even stop a pregnancy from starting. The surprising part is that many women think, oh, this is normal, it will go away. But it doesn't. And it keeps affecting your chances month after month. The good news is you don't need to panic. There are simple things you can do at home to help your body heal. And in this video, I'll walk you through everything step by step, the signs most women miss, and the easy ways to support your fertility naturally. Stay with me, because this might be the one thing you've been missing. Now, if this is happening in your body, the very first thing you should do is check your pH, because honestly, you can't fix a problem you can't see. I highly recommend the convenient, discreet, at-home testing and treatment solutions from WINXHEALTH. They have the tools you need to diagnose your pH imbalance right now. I'll share my link for their products in the description. But first, let's understand why a slight imbalance can be a massive roadblock. Let's break this down in the simplest way possible, because this part is really important. Most women don't realize this, but you can be doing everything right. Tracking your ovulation, eating healthy, cutting back on caffeine, even taking tons of fertility supplements, yet still not get pregnant if the environment inside your vagina isn't balanced. And here's the part many women miss. A lot of vaginal infections don't show obvious symptoms. Some women don't have itching. Some don't have a smell. Some don't have discharge. And still, their pH is off, inflammation is high, and sperm can't survive long enough to reach the egg. So, if you've been trying to conceive and your cycle looks fine on paper, your hormones are okay, and doctors say nothing's wrong, this is the video that might finally connect the missing dots. Let me start with the simplest problem first. Fertility isn't just about your ovaries or hormones. It starts with the ecosystem inside your vagina and cervix, and science actually proves this. A recent review published in the Journal of Clinical Medicine revealed that even a slight imbalance in the vaginal environment can impact sperm survival, egg quality, and even implantation. Now, here's what happens when the vagina becomes even slightly unbalanced. Healthy bacteria drop and harmful bacteria take over. pH levels rise, making sperm die much faster. Inflammation increases, which can block implantation and even affect cervical mucus. The challenging part, a lot of these infections don't show strong symptoms. They can hide, they can come and go, and they can be triggered by things you'd never expect. Your soap, your underwear, your diet, even your stress levels. And here's the part that surprises almost everyone. Even a small infection can lower your chances of getting pregnant by 30 to 60%, depending on the type. Many studies also show that conditions like BV are 3 times more common in women who struggle to conceive. So the real problem is this. Most women who are trying to get pregnant never get screened for vaginal infections unless they are in pain. They assume everything is normal. Let's break this down step by step so you fully understand what's going on inside your body and, more importantly, what you can do to fix it fast and safely at home. What are the hidden infections that mess with fertility? 3 main vaginal issues can secretly interfere with conception. Let's start with the first one, bacterial vaginosis BV. This is the big one. BV is when harmful bacteria take over and push out the healthy bacteria that protect your vagina. And here's something most women don't know. Health organisations say BV is very common. About 1 in 4 women of reproductive age have it. Half of the women who have it feel nothing. No itching, no pain, maybe a smell sometime, maybe not. Research even says BV can be symptomatic or completely silent, which means you can have it and not know. So it's very easy to miss. But inside, BV does this. It raises vaginal pH from 3.5 to 4.5 to a higher, more alkaline level. Sperm die quickly in that environment. Cervical mucus becomes less sperm friendly. Inflammation makes implantation harder. For someone trying to get pregnant, this is a big deal. In a healthy vagina, sperm can live for several days. But with BV and an off pH, it can reduce sperm survival from 5 days down to just 1 hour. So BV is not just a smell or just annoying. When you're trying to conceive, it can quietly cut down your chances in that cycle, and you might never know it's there. BV is a big one, but it's not the only problem. And the next thing is yeast infections. This one feels easier to identify. There is itching, cottage cheese discharge, and burning. But sometimes it's mild or can even present with no symptoms at all. Yeast infections are actually very common. Big studies suggest that about 3 to 5 out of 10 women will have at least one yeast infection in their life. And a global review estimated that around 138 million women struggle with recurrent yeast infections every year, mostly in the childbearing years. Yeast infections can affect fertility because they change cervical mucus texture. They increase inflammation. They make sex painful, which makes timing intercourse hard. They also tend to come back if your pH is off or your gut is imbalanced. There's one more problem that almost nobody hears about, and this one really gets ignored: aerobic vaginitis, or AV. It's not BV and not yeast. It's when certain bacteria cause inflammation inside the vagina and cervix. The problem? AV has been linked to infertility, early miscarriage, and implantation failure. And just like BV, AV doesn't always shout for attention. It can be there quietly, maybe a bit of discharge, a little discomfort, or sometimes nothing that feels serious at all. While in the background, that inflammation is making it harder for a healthy pregnancy to start and stay. This is why it's so important not to ignore small symptoms or assume everything is fine just because there's no pain. Now, how do these infections affect ovulation, egg quality, and implantation? Most TTC women are told the same advice: track your cycle, take prenatals, eat healthy, and reduce stress. But no one explains what's happening in the vaginal environment when it's unhealthy. Let's make it simple. 1. A healthy vagina is slightly acidic. The right pH protects sperm, the wrong pH kills them. When infections like BV are present, pH often goes higher, more alkaline, and in that environment, sperm die much faster and don't move well. 2. Healthy lactobacillus bacteria create lactic acid. This acid helps sperm reach the egg safely. When there's too little lactobacillus, harmful bacteria grow. Your pH goes up and the whole balance changes. 3. Inflammation lowers fertility. Inflammation affects cervical mucus, the lining, and even the immune response. Some infections trigger inflammation even when you can't feel it. 4. Cervical mucus changes drastically. When your vagina is infected, your mucus becomes too thick, too sticky, too hostile, or sometimes too watery. In all cases, it becomes bad for sperm movement. 5. Infections can cause antibodies that attack sperm. Some women develop something called anti-sperm antibodies when the vaginal lining is inflamed. This makes the body treat sperm like an invader. We also have the symptoms most women miss. So now you know how these infections can affect sperm, your egg, and implantation. But the big question is, how do you even know this is happening in your own body? Because most women think, I don't have strong itching or pain, so I must be fine. That's where a lot of people get stuck. Let's go through the red flags that most women ignore or assume are normal. If you don't have the obvious symptoms, pay attention if you notice. Frequent discharge changes, discharge that's watery or thin, a fishy smell after sex or period, cramps that feel different from period cramps, light spotting after sex, itching that comes and goes, burning after peeing, painful sex, a feeling of rawness, more UTIs, more gas or bloating, increased stress or fatigue. The reason for this last one, your gut microbiome and vaginal microbiome are connected. When one is off, the other usually is too. If any of those symptoms sound familiar, you need to stop guessing right now. The difference between a healthy cycle and a failed cycle is often just a few points of pH. You need immediate answers, not a doctor's appointment in 3 weeks. This is why I consider the WINXHEALTH health test and treat kits essential. Their kit gives you the immediate objective evidence you need to confirm if you have a pH imbalance, yeast or BV, allowing you to move directly to treatment without delay. Knowing your status protects your sperm, your cervix and your sanity. Use my discount link below to stop guessing and start balancing. Finally, the everyday habits that quietly trigger vaginal infections. Because those symptoms don't appear out of nowhere, very often they're being fed by small things you do every single day without thinking about them. This is where many women get surprised because it's usually normal habits like 1. Using scented soaps or feminine washes. These don't just make things smell fresh. They can wash away the good bacteria that protect your vagina and irritate the skin and lining. 2. Wearing tight leggings or synthetic underwear all day is another one. When the area stays warm and damp, it becomes a perfect place for bad bacteria and yeast to grow. 3. Eating a lot of sugar also plays a role. Yeast feeds on sugar. So a high sugar diet can make yeast infections more likely and make them come back again and again. 4. Then there's unprotected sex many times in one cycle. Semen changes vaginal pH. If your body can't rebalance quickly, infections start. 5. Stress is a big factor too. Cortisol lowers healthy bacteria levels. 6. Antibiotics can also quietly change things. One course of antibiotics can wipe out your entire healthy vaginal microbiome. 7. And even something as simple as using panty liners every day can add to the problem. All of this adds up. And when you're TTC, even minor changes in your vaginal ecosystem matter. You've seen how many little things can throw off the balance down there. So the big question is, what can you actually do right now at home to start fixing it? This is the part you need to replay, save, or write down, because this is the step-by-step plan that helps reset and balance your vaginal microbiome safely at home. I'm giving you the version that fertility doctors, practitioners, health specialists all agree on. Step 1 is the most important one. Do an at-home vaginal pH test. You can't fix what you don't measure. This takes 10 seconds. You can buy a vaginal pH test kit online or at a pharmacy. A healthy vaginal pH is usually around 3.5 to 4.5. If your result is higher than that, it often means there may be BV or some kind of imbalance going on. Please don't skip this step. This number tells you what direction your body is going in, and it helps you understand whether your vagina is in a sperm-friendly state or not. Step 2 is about what you stop doing. Stop all scented products for 30 days. No scented soaps, scented body wash, feminine wash, scented pads, scented toilet paper, nothing. These products destroy healthy bacteria. Instead, switch to very simple things. A gentle, unscented soap for the outside only, just water on the vulva. Cotton underwear, no daily panty liners. For some women, just doing this alone already makes a huge difference. Step 3. Add a high-quality vaginal probiotic. This is the most important step of all. Your vagina needs lactobacillus strains, especially lactobacillus rhamnosus, lactobacillus reuteri, lactobacillus crispatus, the most effective one. A good women's probiotic can help restore pH, reduce inflammation, and push out harmful bacteria. Take it for at least 30 to 60 days. If you have any medical conditions or take other medicines, check with your doctor before starting new supplements. Step 4. use boric acid suppositories, but only if you have symptoms or BV type pH. The next tool some women use is boric acid suppository, which is one of the most effective ways to reset vaginal pH when it's too alkaline. It's helpful for things like BV, recurrent yeast, odour, discharge, imbalance, pH issues after sex or period. There are some very important safety rules. You should not use boric acid while pregnant or while trying to conceive during your fertile window. So here's the safe schedule. Use boric acid from the end of your period till just before ovulation. Then stop during your fertile window. Resume after your period again if needed. Most women need 3 to 7 days for mild symptoms. Some need longer, depending on their pH test results. Step 5. Fix your gut microbiome. Your vaginal health is directly linked to your gut. If you often feel bloated, crave a lot of sugar, struggle with constipation or loose stools, or keep having skin issues like acne or rashes, there's a good chance your gut is part of the reason your vaginal problems keep coming back. Simple things can really help here. Taking a daily oral probiotic, the one your doctor recommends, cutting down sugar, adding more fibre from fruits, vegetables, seeds and whole grains, drinking enough water and reducing alcohol if you drink often. When the gut starts to calm down and rebalance, the vaginal microbiome often follows along. Step 6. Protect the vaginal microbiome during sex. Here's something no one tells women who are TTC. Semen is alkaline and your vagina is naturally more acidic. When semen enters the vagina too often within a short time, it raises the vaginal pH. If your microbiome is already sensitive, you may get BV-type symptoms right after sex. So here's what helps. Peeing after sex. Rinse the outside with plain water, not soap, avoiding douching, and skipping scented wipes or sprays around the vulva. During your fertile window, this is especially important because you're having sex more frequently. Step 7. Strengthen your immune system. There's also your immune system to think about. Your vaginal microbiome is part of your immune system. If your immunity is low, you'll keep getting infections. Help your immune system with vitamin D, omega-3, zinc, enough sleep, less stress, light daily movement. Even small changes here, a bit more rest, a short daily walk, slightly better food choices can help your body fight off infections and hold on to the good bacteria. Step 8. Know when you need a doctor. At-home methods work, but there are times when you need medical support. Go to a doctor if you have pelvic pain, you have a fever, you have strong odour, your infection keeps returning. Sex is painful. You have been TTC for 12 plus months with no answers. A doctor can test for AV, BV, yeast, STI, and inflammation markers that aren't visible. Most women don't realise how much vaginal infections matter when they're trying to get pregnant. They think infections are just uncomfortable or annoying. But the truth is, even mild imbalances can mess with pH, kill sperm early, change cervical mucus, inflame the vagina and block implantation. The good news is that restoring your vaginal microbiome is not complicated. It takes a few simple steps, a few adjustments in your habits, and a little consistency. Your fertility isn't just about your hormones. It starts with the environment that sperm travel through. When that environment becomes healthy and balanced, your chances of getting pregnant rise almost instantly. You don't need to guess, you don't need to panic, and you don't need to wait for months. You can test, fix, rebalance, and support your body starting today. Don't let a hidden imbalance sabotage another cycle. Take action with immediate, discreet home testing. Click the link in the description now to get the complete vaginal health kit from WINXHEALTH. It's the fastest way to confirm your pH, treat any infection safely, and create the perfect, welcoming environment for conception. Watch the next video to boost your chances even more.